Today we'll be discussing risk management and safety in the home care environment. Safety is freedom from danger, risk, or injury. Risk management is what we do to keep ourselves safe. We work together as a team to keep our clients and ourselves as employees safe. We work safely and attend safety trainings when offered. Today we are going to identify common environmental risks home care workers may be exposed to, outline the potential impacts from environmental risk, describe strategies and tools that can reduce risk, and follow positive problem-solving steps with clients to reduce risks.
Home care is unique, placing nurses and other healthcare professionals in patients' homes and personal spaces, and doesn't include typical healthcare organization requirements. Home care workers who provide home care may face safety risks because they work alone, even in high-risk areas. They may be exposed to a variety of potentially serious or even life-threatening hazards, including overexertion, stress, guns and other weapons, illegal drugs, and verbal abuse and other forms of violence. They may be exposed to bloodborne pathogens, communicable diseases, needle sticks, latex sensitivity, temperature extremes, and unhygienic conditions. They must often commute long distances from worksite to worksite and are in the personal setting of a person's home. Home care safety can be divided into 3 responsibilities. Workers' responsibility to protect their own safety, using universal precautions and reporting any changes or problems with the client. Agency and organization responsibility is to train workers and provide workplace safety practices. We provide yearly training on a variety of subjects that can assist the attendant with client care, and patient and family responsibility to promote home care team member safety. Home healthcare workers may be exposed to infectious diseases during home visits and may even be a source of infection to the patient if the worker has an infectious disease or uses dirty equipment. Although the bloodborne pathogen standard includes protection from blood and other potentially infectious materials, an additional infection control and prevention program needs to be in place to protect home healthcare workers and their patients. Our agency provides yearly training on safety and emergency procedures that is required by the state. We provide gloves, masks, and hand sanitizer here in the office if they are needed. Make sure you are up to date on your training and contact the agency for any clarification. Hand washing is the most important form of preventing the spread of infection. For hand washing to be effective in preventing the spread of infection, it must be performed thoroughly, properly, and consistently. Because frequent hand washing can cause the skin to become excessively dry, leading to cracking, applying a lotion or hand cream after washing is recommended. Remember, your own intact skin is important to help protect you from infection too. At the minimum, wash your hands when you first arrive at your clients, before handling clean linen, before handling a client's meal tray, before you go on a break, and before you leave your shift, and also before and after drinking, eating, or smoking. Hygiene may be a concern of home health care workers. Unsanitary homes may harbor pests including rodents, lice, scabies, or termites. Disease-carrying pests in healthcare environments pose deadly risk to vulnerable patients, frontline workers, and visitors who require a safe, hygienic environment free of insects and rodents. Please inform the agency of any hygienic problems in the client's home so that we may assist in any steps to make sure that the attendant, the client, and any visitors are safe in the client's home. Wash your hands after contact with any body fluid, whether it is your own or another person's. Examples of body fluids include blood, saliva, vomitus, urine, feces, wound drainage, pus, mucus, and respiratory secretions. Wash your hands frequently, especially after using the bathroom, before handling food, drink, or eating utensils. and before and after any contact with the client. Provide each client with individual personal care items such as toothbrushes, drinking glasses, towels, washcloths, and soap. Dispose of trash properly. Maintain good personal hygiene and help your clients do the same. Bathing, washing hair, brushing teeth, and wearing clean clothing are all grooming practices that help to prevent the spread of infection. Use gloves and wash hands often. Change and wash clothes and hair after work. During this pandemic, please remember to always wear your mask, wash your hands, and practice social distancing while in the client's home, even if you are fully vaccinated.
Home healthcare workers may encounter a home with no running water or water that is of poor quality. Homes may use bottled water for drinking and have access to cisterns for flushing and bathing. Please inform the agency if the client does not have running water in the home on a regular basis. Home healthcare workers do not have control over walkways and may encounter icy pavements, wet floors, or wet carpeting. Loose area rugs and other floor coverings can also be hazardous for workers and for patients. Agency staff should assess the client's home for anything that could be hazardous to the client. Some examples include loose carpet and rugs, electrical cords, clutter, open drawers, pets, poorly maintained steps and floors, wet or slippery floors, poor lighting, stairs without railings, icy pavement or steps. And also, here's some additional tips to prevent injury while bathing a client. Have all supplies ready and nearby before beginning. Limit bending and twisting. Use a stool at the bath. Make bathing easier by using handrails, a shower chair, a handheld shower hose, a long-handled brush, and also get as close to the client as possible. All occurrences such as accidents and injuries that result in injury to the client or agency staff must be documented on an incident report. Examples include if a client falls while the staff is present, car accidents while with the client, or staff injury while on the job. If the client falls while the attendant is not present, that can be reported to your supervisor. It is imperative that you report incidents and accidents as soon as possible.
Cleaning agents are an additional hazard that you might come across in the client's home. Cleaning agents are used often and are at risk for injury while using such substances. Always use separate gloves for cleaning. Always use in a well-ventilated area, and always keep products in their original labeled containers. Cleaning supplies and household products containing toxin substances can include, but are not limited to, aerosol spray products, including health, beauty, and cleaning products, air fresheners, chlorine bleach, detergent and dishwashing liquid, dry cleaning chemicals, rug and upholstery cleaners, furniture and floor polish, and oven cleaners. Never mix bleach or any bleach-containing product with any cleaner containing ammonia. The gases created from this combination can lead to chronic breathing problems. Please be mindful of clients with breathing issues such as COPD or asthma, as they may be sensitive to harsher cleaning agents.
And lastly, here are some do's and don'ts when lifting or transferring clients. Don't try anything you think might be unsafe. Get help from another person. If the client can't partially support his or her own weight, it is not safe to lift or transfer the client by yourself. Talk with your client as you're doing each step. Keep the client close to your body while you help. Bend your knees, not your back, while moving. Turn your feet and whole body. Do not twist at the waist. Have clients' arms around your body, not your neck. Put one foot forward, the other back. Use a draw sheet to move a client in bed and move along the bedside to avoid reaching. And always make sure that the bed or wheelchair wheels are locked before moving a client.